At Trinity Health Livonia, the Bedside Mobility Assessment Tool, or BMAT, and the Timed Up and Go, or TUG test, should be utilized to assess the mobility of every patient, every shift. BMAT and TUG not only allow us to quickly and effectively identify a patient's mobility level and mobility needs, but improve patient outcomes and staff safety. This video will explain and demonstrate how to perform the BMAT and TUG assessments. Based on those assessments, you will be able to identify the specific mobility equipment, interventions, and goals to implement with your patient. Those aspects of BMAT and TUG are explained in a separate video. The focus here is to understand how to perform the assessments. There is a useful decision tree available on the Trinity Livonia SharePoint page to guide you in the mobility assessment of patients. Begin in the top left corner. Is the patient medically appropriate for mobility assessment? To be inappropriate for mobility assessment, the patient has to be hemodynamically unstable, on a vent or BiPAP, or have an active bed rest order on the chart. But if that is the case for your patient, you would answer no, and the stop sign signifies you do not continue with any form of assessment at this time, but that does not mean you're done with BMAT and TUG. Reassessment is required for all patients. You will reassess every patient every shift, and when there is any perceived change in the patient that could impact mobility. The next prompt is to ask, do you think the patient is independent? If you believe your patient can ambulate independently, even if they need an assistive device like a walker or cane, you can go directly to the TUG test. To perform the TUG test, first apply the gait belt to the patient. If the patient requires the use of an assistive device such as a walker or cane, they can utilize that for this test. Direct the patient to get into a seated position at the side of the bed or a chair. To pass the TUG test, they must stand from a seated position, walk independently 10 feet out, turn around, walk back, and sit back down. This should take 12 seconds or less. Since we don't have a standard 10-foot measurement in rooms, have the patient walk from the side of the bed to the bathroom door and back. Time them as they walk, and walk beside them ready to take the gait belt if the patient shows any weakness. If they are able to stand up, walk out and back, and sit down in 12 seconds or less, they pass the TUG test and are considered independent. No further assessment is required at this time, but reassessment of the patient is still a requirement. If they are unable to do this activity or take longer than 12 seconds, they fail the TUG test. If upon initial assessment you did not think that the patient would be independent, you do not need to perform the TUG test first, but instead go directly to the BMAT. Also, if they fail the TUG test, you will go directly to the BMAT. The BMAT will identify what mobility level to label the patient. To perform the BMAT, always begin at step 1 and progress to subsequent steps only if the patient successfully completes the previous step. When the patient fails to complete an assessment, it will indicate what mobility level to label the patient. Step 1 is sit and shake. With this step, you are assessing basic core strength. Do they have the strength to maintain their balance when seated? The patient must be able to sit unassisted. You are allowed to assist the patient into a seated position, but they must be able to maintain that position without your aid. If they demonstrate the ability to sit and support themselves, ask them to shake your hand, and make sure that they have to reach across their body to shake your hands. Have them shake with both hands. Are they unable to maintain the seated position independently, or do they lean one way or the other while attempting to reach across the body? If they have the required strength, they shouldn't have these issues. So if you observe either of these issues, they fail step 1. Keep in mind, we are not assessing arm strength. If the patient has an arm in a sling or for some other reason they are unable to reach across and shake your hand, you just need them to twist their body from their core to test their strength and balance. If the patient fails step 1, they are designated a mobility level 1. If they pass step 1, then you will proceed to step 2 of the BMAT assessment, which is stretch and point. We're checking for knee and ankle strength and flexibility. To complete this step, with the patient still in a seated position, have them straighten their leg by bending at the knee. With leg extended, have them flex their ankle to point their toe outward. It is okay to prompt the patient with various types of directions. We are assessing their functional mobility, not their cognitive level. The added prompting and direction can help progress the assessment more smoothly. So have the patient stretch and point with both legs unless there is some restriction, such as weight bearing on one leg or the other, or amputation. If they can complete this task with at least one leg, they pass step 2. If the patient cannot stretch and point with either leg, they fail step 2 and are designated a mobility level 2. If they pass step 2, you will progress to step 3, stand. The patient needs to be able to stand from a seated position, or at least lift their buttocks off the bed or chair for 5 seconds. It is okay to allow the patient to use an assistive device such as a walker, or for them to use the side rails or armrest to support themselves as they stand, but they must do this task on their own power, not with your assistance. We're moving up from the ankles and knees and assessing for strength in the patient's legs that would support their standing and balance. If they cannot at least lift their buttocks off the bed for the 5 count, they fail Step 3 and are designated a Mobility Level 3 patient. If they pass Step 3, you will progress to Step 4, March and Step. With the patient still in a standing position, instruct them to march in place for 5 seconds. If they need to utilize a walker or other assistive device such as a cane, that is acceptable. After marching in place for 5 seconds, have the patient step forward with one foot to shift their weight forward, and then step back to a standing position. Then repeat with the opposite foot. You are watching for good stability and balance in your patient. If they cannot perform both of these tasks, they fail Step 4 and are designated a Mobility Level 4 patient. Level 4 patients may be able to ambulate, but they are not independent. If the patient passes Level 4 and you did not already perform a TUG test, proceed to the TUG test described at the beginning of this video. If they fail the TUG test, they are still a Mobility Level 4 patient. If they pass the TUG test, they are considered independent. Once you've successfully completed the BMAT and TUG assessments, you're not done. Remember, reevaluation is crucial. Reassessment is required at least once per shift and whenever there is a perceived change in the mobility status of a patient. Every time BMAT and TUG assessments are completed, make sure to update the door magnets with the date and time and the results of the assessment. Further information on implementing the results of the BMAT and TUG assessments can be viewed in a separate video titled BMAT and TUG, Performing the Assessments and Implementing the Results.